Hi, everybody. Welcome to the Ask Julie Ryan Show.
I'm Julie, your host, and I'm so delighted you could join us this week. My intention in doing this show is to provide information, insight, and comfort to people all over the world by helping to answer life's unanswerable questions. We've got a whole bunch of callers on hold, so we will get to them here momentarily. But first, a couple of things. My January Angelic Attendant Training class starts this Saturday, so I'm so excited to welcome the 17th class already, you guys. I can't believe there's been 17 classes go through. I limit it to 12 people. It's very one-on-one and in a group. We have discussion and lecture in the first hour, and then the rest of it's practicum, and everybody learns to do all the stuff that I do in 4 weeks. I teach the class quarterly. It's a blast. You're going to be amazed if you take it, how you can do all the stuff that I do very easily and quickly. And I have 3 spots left for April's class. So just wanted to let you know that if you're thinking about wanting to take the class, then go ahead and sign up for the April class because it's going to fill up quickly. Just go to AskJulieRyan.com. Click on the training button and you'll see all the details about that. Secondly, since it's the first Thursday of the month, I am doing a free giveaway for a free session valued at $200. And in order to get into the drawing for this, I give a free one away every month, is you just go to AskJulieRyan.com, leave a review. You can leave a review on YouTube. You can leave a review anywhere you download podcasts and just say, hey, I listened to the show and here's what I think of it. And you'll be entered into a drawing. And I will give you a free session, which is an hour, and we can talk about whatever you want. We can scan you medically. We can scan your pets. We can do past life stuff. We can tell how close to death somebody is. We can talk to your spirit guides, your deceased loved ones, because I am a buffet of psychicness. So we cram as much into an hour as we can, and it's really fun. All righty, here's the winner this month for January's free session. It's Marie Grace Berg is what she calls herself, and she lives in Norway. And she says, ever since I listened to an interview of Julie Ryan with Dave Asprey, I've been binge listening all the episodes on her podcast. That's a lot because this is episode 344 tonight. So that's a lot, Marie. And she went on to say, and I have to say, I'm hooked. This is my favorite place now to get answers to questions. I want answers around the topic of spirituality, angels, guides, deceased loved ones, life purpose, etc. Can't wait to listen to future episodes. Highly recommend. So, Marie Grace from Norway, you have won a free session, and please email or go onto my website, AskJulieRyan.com, go to the Ask Julie button, and if you would just put a note, say, hey, I'm the winner, and then what we'll do is we will find a date and time that works with your schedule and mine, and we will get you your free session. So congratulations. And again, any of you that want to be included in the drawing, just leave a review anywhere you download podcasts on YouTube. You can do that too. Alrighty, let's go to the phones. And our first caller is Deborah. Hi, Deborah.
Hi, Julie. How are you? Thank you for taking my phone call.
You are so welcome. Where are you located?
In Middletown, New York.
Okay. Terrific. You got a question for me?
Yeah, my husband, Sean, had in March, he had melanoma on the bottom of his right foot. They removed that as well as 2 lymph nodes that were cancer, also a melanoma. They put him on Opdivo immune therapy once a month IV, but I guess it didn't work at all because now it came back a few months later and he's got tumors in his right leg groin area that was biopsy show melanoma again, and he has to go for surgery at Sloan Kettering, hospital in a few weeks. So I don't know if you could help with that. I'd appreciate it.
Yes. Well, that's an amazing hospital. So it sounds like he's going to be in really good hands there, Deborah. What I'm going to do is I'm going to connect to you and from you to Sean. And then I will ask his permission if I can scan him. How this works for those of you that are first-time listeners is I learned how to do all this stuff. I'm a businesswoman and an inventor who learned how to do woo-woo. And so I raise my vibrational level. It just takes a nanosecond. I learned how to do this. And this is what I teach in my classes. And I'm going to watch a laser beam, Deborah, come from my body here in Birmingham, Alabama. It's going to hook into you in New York. And then I'm going to go from you to Sean. And I will ask him permission if I can scan him. If he says, yes, I will. If he says, no, I won't, just because I think it's unethical to do that. I think it's an invasion of privacy. And if he says yes, then I'll have a hologram of him in my mind's eye. And it'll be like I'm looking at an X-ray or a CT scan or an MRI. Something will be identified. There'll be a healing. My healing descriptions sometimes are really hilarious, Deborah. And it's just how they come in, honestly, to my head. And so it can give us a frame of reference for what I'm seeing energetically, because we don't have any human frame of references for all this energy healing stuff that I do. And it's spirit working through me and with me. So that's what we're going to do. Did you talk to him about us scanning him tonight by any chance?
Yes,
Great.
He knows. Yes, he knows that I'm calling in tonight.
Okay, good. Did you have to twist his arm?
No, not really, because I think he's scared,
Yeah, I bet. Okay, so I want you to envision what I'm seeing as well, what I'm describing, because you'll be my assistant. That'll help integrate the healing into his body. So here we go. Here comes my laser beam from Sweet Home, Alabama, heading up to you in New York. All right, got you. Going from you to Sean. Got Sean. Sean, I'm talking to Deborah. He says, I know, it's fine. Good job setting that up. Okay, so I'm shooting energy through him. And, okay, it's going to his groin. Where the energy went first, Deborah's on the right side of his groin. And so what I'm doing is encapsulating those nodules, tumors, whatever they're calling them, and then removing them energetically. Okay. And then we're going to put a little bit of stem cell energy in there to regenerate that tissue. Stem cell energy, Deborah, looks like a light amber colored gel, has sparkles in it because it's woo-woo, gotta have sparkles. And it reminds me of Dippity-Doo hair gel from the 60s and 70s. Do you remember that? It's kind of a watery hair gel. Yeah. I have young women tell me that they have to look up what that is. And then they'll send me an ad from like the 60s with it. But it's just what it looks like.
Right.
So got that. There's a vortex spinning above him. That's going to regenerate the tissue there. Stem cell energy is the coolest stuff because it will regenerate anything, any body part we need. And I have watched it over the years regenerate whole organs like kidneys and livers and stuff. And then I'll have doctors call me when a new organ shows up on a subsequent scan and they'll say, what are you doing? And how does this stuff work? Which is hilarious when that happens. Oh, wow. All right. We're doing a DNA healing now real quickly on him, Deborah. DNA looks to me like pieces of paper you'd find inside a fortune cookie with a fortune written on it. DNA is the recipe that tells the cells how to behave. It's comprised of 4 nucleic acids. It's represented by 4 letters, A, T, C, G. One strand of DNA can have 100,000 letters, can have 1 billion letters. I'm watching those letters get resequenced as if we're watching a Scrabble game in warp speed where letters are being moved up and over, in Scrabble to form a word. So that's happening. There are 7 strands that have come out of an X chromosome. Boys, if you remember your grade school biology lessons, boys have an X and a Y and girls have 2 X's. So I always see an X come out. So 3 strands have gone back in. I've got 4 more to go. Okay. 2 more have gone back in. I got 2 more to go. And they snap back in. Those tape measurers that perhaps you have it in a sewing kit and you stretch it out and you push the little button and it comes flying back into the container that's in the housing. That's what I'm watching. Right. All right. 7. So DNA just went back in. Chromosome just went back in his body. So that's good. That'll help. All right. So we're doing a lymph cleanse right now. Imagine there's a pneumatic tube. Think of those tubes at the drive-through at the bank that you put one of those little containers in and then it sucks it up into the building when they push the button or when you push the button. That's what this reminds me of. And all of his lymph fluid has gone into that. It's an oval, vertical oval in front of him, in the front of his body, I should say. And lymph fluid, Deborah, looks to me like an amber color gel, but it's kind of globby. Think of the gel or the fluid that's inside a lava lamp. You know how that stuff's kind of globby and goopy. And so that's spinning. There are holes on the bottom of each of his feet that have opened up. And that's where the toxins and the debris are leaving his body. What we're doing is a reverse osmosis procedure, kind of like when you hear or when you read about a bottle of water that's been purified, Aquafina Dasani, one of those, it'll say microfiltered and reverse osmosis purified. That's what we're doing. And so that lymph fluid inside that tube in front of him is spinning very, very fast to the point now where it just looks brilliant, like a brilliant white light. So that's happening there. Okay, very fast. Got that going on. Okay, got that. And questions as I'm watching this finish up. Any other things you want me to check while I've got them on my radar?
Yeah, anything else you see that needs healing and help so it never comes back again?
Well, that's what we did with the DNA healing. Let's just fix the recipe so that the mutations are gone. Yeah. In the short run, one thing that, depending on what they want him to do for treatment, something that's really helpful, Deborah, you may want to find out about this in advance, is when somebody has especially chemo and or radiation, if you can get them right in after their treatment to an acupuncture doctor, there's huge results that are positive for anybody going through that. And so look into that. I know the University of Washington and other university hospitals have departments now that do that. So somebody comes like from getting their chemo treatment and they go right into the acupuncture, and it'll help reduce the symptoms and help them heal. So hopefully that will help. Please keep us posted on how he's doing, and we'll remember him in our prayers. Okay. Thanks for calling.
Thank you.
Stay with us, everybody. We're going to take a quick break. When we come back, we'll get more callers on. You're listening to the Ask Julie Ryan Show. Be right back. Welcome back, everybody. Let's go to the phones. Our next caller is Cheryl. Hi, Cheryl.
Hi, Cheryl. Yes, thank you, Julie. Hey, I just wanted to say thank you. I had a really amazing session with you recently, but actually I'm not calling for myself. I'm calling for my brother. And I wanted to see if you could do a healing on him. We were just messaging back and forth for a little bit today, and he said that his shoulder was really bothering him. I'm not sure exactly. He said he was kind of laid up in bed, so I know it has to be quite painful in order for him to be laid up. So I'm not sure which it is. So I was wondering if you could do a mini healing and see what's going on there.
Sure. Please tell everybody where you're located.
Yeah, I'm in Delaware.
Okay, and where's your brother, and what's his first name?
He lives, is Greg, is his first name, and he lives in Tennessee.
Okay. All right, so what I'm going to do, Cheryl, is I'm going to hook into you, and then from you, my laser beam is going to go down to Tennessee. So here we go. We're going to go up and down here. I'm coming from Birmingham, heading up to you in Delaware, and then back to Tennessee. All right, got you. Coming back to Greg. Greg, I'm talking to Cheryl. Do I have your permission to scan you energetically? He said, sure. Okay. Did you set that up with him, or we're rolling the dice?
Yeah, I mentioned it.
Okay.
Yeah, no, I mentioned it. So he should be good with it.
Good job. Okay. So shooting energy from his feet up through the top of his head. All right. The energy went to his right shoulder first, Cheryl. I'm looking at him from behind. And let's see what's going on there. What did he do? Was he in an accident or something? What happened to him? Did he fall?
Not really sure. We don't.
Okay.
Yeah, we don't really talk too often, and it was just kind of messaging a little bit back and forth. So I didn't get really too many details. I just asked him if he would be open for a healing.
Yeah.
Kind of, you know how it is.
Right. Well, and sorry guys that are listening, but they're not forthcoming with details. That's why we all ask so many questions and drive a lot of them nuts, because it's like, come on, what's the story? What are the details? So what I'm seeing, Cheryl, is I watched his shoulder get it. Say that again.
Normally I would ask him more details, but I just didn't. As soon as he said that he would be open to a healing, I was like, okay, let's just leave it at that. Let's Jolie see what's going on there and do a healing.
Great. Am I on speaker by any chance? I'm hearing some feedback. If I am, please get me off speaker. So what I'm seeing is I watched a chiropractic adjustment on his shoulder, and it looks like he's got a little bit of a rotator cuff tear. So if I put the round face of a clock on his shoulder, it's in like the 12:30 position between the 12 and the 1 at the top. And so I'm watching that get stitched up. A rotator cuff tear, to me, imagine it looks like somewhat of a little V. And so I'm watching energetic sutures stitch that up, and then we're going to put a little stem cell energy on there to help it heal. So done being stitched. All right, stem cell energy going on, and light amber colored gel, sparkles, dippity-doo. It's got a vortex, little tiny vortex spinning above it. The centrifugal force is what transforms the stem cell energy into whatever body part we need. And if you think about it, Cheryl, every cell has a nucleus. Every nucleus is surrounded by cytoplasm, which is a watery gel like dippity-doo. And our bodies have a centrifugal force in them that spins that causes our cells to divide and replicate to the tune of billions of them a day. So I believe these stem cell energy healings that I watch in my mind's eye are just that what our bodies do naturally. I'm just watching it in warp speed for part of this healing. So hopefully that will help. You are a sweet sister calling in for your brother.
Oh. Well, I thank you very much for doing the healing, and I'm going to have him listen to this replay, and then he can make a full hour appointment with you. So
there you go. Yeah, sounds good.
Too, so
okay.
Awesome.
Thanks, Cheryl.
So nice.
Bye. All righty, let's go to Deborah next. Hi, Deborah. The other Deborah. We've had two Deborahs on. Hi, Deborah.
Am I on?
Yes, ma'am. Yes, ma'am.
Oh, okay, I'm on. So I'm Deborah Cox. I'm in Santa Fe, New Mexico.
Terrific. Welcome.
Hi.
Got a question?
Oh, great. Thank you so much. Yes, I hurt my right leg back in August, and it's still healing almost 5 months later. And I don't know, I'm really worried why it's not healing, why it's healing so slowly. I also re-injured it three months after the first bike fall, and then it's just been really slow healing, and I'm worried about getting my range of motion back. I don't know what's wrong with it.
Did you get it x-rayed, or did you get an MRI on it, Deborah?
I've had it x-rayed, but when I fell on it, and the second time I fell, I did not get it x-rayed because I didn't really fall. I just kind of tripped on some stairs and bent it really farther than it had ever bent before. Excruciating pain. And I have not had an MRI yet.
Okay. All righty. So I'm seeing, does it hurt behind your knee? That's what I'm seeing is some ligaments and stuff behind your knee. Is that where it hurts the most?
No, it hurts the most in the front.
In the front. Okay. Well, the energy went to the ligaments first in the back, so we'll do that. And I always watch a chiropractic adjustment first. Not always. A lot of the time I'll watch an energetic chiropractic, easy for me to say, adjustment happen first, just to get it all lined up. Do you see a chiropractor? Have you gone to see a chiropractor since you injured your leg?
No, I work with a physical therapist.
Okay. So are they doing adjustments? A lot of physical therapists will do chiropractic adjustments on the sly. They won't tell anybody.
I don't know. It doesn't feel like he's doing chiropractic.
Okay. All right. So yeah. So I've got stem cell energy on the ligaments. And what I'm watching, when I see a ligament or a sprain, you'll say my ankle or my leg has got a sprain on it. It looks to me like jumbled up threads almost. Like if you can imagine a rope that's used to dock a boat, to tie it onto the dock. And it's usually twisted, but you can see the individual threads in it. So imagine those threads, but they look tangled to me. So what I'm watching happen as part of this healing is I'm watching them get untangled, and then I'm watching stem cell energy go on them to help them. It's interesting to me that the pain's in the front because all the healing's happening in the back. I don't know what to tell you. That's just what I'm seeing. So what is your physical therapist and what are your doctors saying?
There's a lot of swelling on the top, and the swelling just won't go down. So it's inhibiting my movement, we think. And so I'm going to the doctor next week, but I really don't want a diagnosis, and I want this swelling to go down. So, really almost 5 months.
And it's been really swollen for 5 months. The thing about the swelling is it's helping you heal. I know it's a pain, but it helps you. It's the body healing itself. So that's what I'm getting on it. I hope that helps, and I hope you get some. Do you put an ACE bandage, or are you wrapping something around it to keep it tight?
Not anymore. This has been a month and a half. This is after the injury I had in November. I fell and I re-injured it, so that's when the big swelling happened.
Yeah,
but it was recovering nicely before I re-injured it.
I put some anti-inflammatory energy, which is royal blue color, on it. But what I'm getting is, those neoprene braces that you can get. It's not really a brace. It's more like a little compression thing that you can even get them at the drugstore. I get to wrap it in an ACE or wrap it in, use one of those neoprene things. And that's going to help the swelling too. So hopefully you feel better, and I hope that healing helps you. Thanks for calling. All righty, let's go to Bobby next. Hi, Bobby.
Hi, how are you? Happy New Year, Julie.
Thank you. You too. Where are you located?
Well, I am in snowy Eden Prairie, Minnesota. We had about 17 inches of snow.
Oh, heavens, girl. Oh, my goodness. Well.
I know.
Oh, wow.
Just got out after 2 days of being in the house. I know. I know.
I knew you were getting a bunch of that stuff, but that's a lot.
Yeah. It's a lot. Yes, it is. Say, I have a question regarding my husband, Jerry. He has MDS, which is a bone marrow failure disease, and he's had 52 blood transfusions.
Oh,
and he actually was doing pretty well, but he's been having trouble recently, and they just found out that his ferritin levels are like toxic. He's at 6,800, and normal is 450. So they're going to put him on some medication that sounds very scary. And this is really kind of a very serious situation because he's having a hard time breathing and he's got, terrible fatigue with this. I was just wondering if you could kind of scan him and see, or if there's anything that could be done to help.
Yeah. What I'll do is I'll connect to you, and then I'm going to connect from you. Is it Jerry with a J or a G, Jerry?
Jay.
Okay, Jerry. All right, so here we go. Comes my laser beam from Sweet Home, Alabama, heading up to you. Just want you to know I was walking in shorts and a T-shirt this morning in Sweet Home, Alabama, so I'll send some warmth up to you. Nothing like rubbing it in, right? Okay. All right. Got that. Yeah. Okay. What I'm doing, Bobby, is I'm watching a heavy metal detox. Imagine there are two big U-shaped magnets that are surrounding Jerry. They're joined in the middle. They go up and down his body. They pull out metallic particulates. They then turn a quarter of a turn up and down his body, pulling out the particulates, turn a quarter of a turn, same thing, turn a quarter of a turn, same thing, pop off, irrigating metallic dust out of him. And then watching stem cell energy go in and just try and equalize things. Stem cell energy is just such an amazing tool. And I use a lot of it on somebody I always love. I say, you're going to be like the bionic babe by the time we're done with you today, or the bionic man with all this stuff going on. And so I'm watching that as well. Heavens. Okay. All right. Well, I hope that helps. The medicine that they're going to put him on, I get, is going to benefit him. So I think that's a good thing that they're doing that. So keep us posted. Yeah, let us know how he's doing.
Oh, I thank you so much.
You're welcome. Thanks for calling. Hope he feels better. All righty. Time for another quick break, everybody. We will return shortly with more callers and see what their questions are and see what Spirit has to say about it. So stay with us. You're listening to the Ask Julie Ryan Show. Welcome back, everybody. Let's go to Myra next. Hi, Myra.
Hi, Julie. Thank you for getting my call. Happy New Year.
Thank you. You too. How may I help you? Where are you, first of all?
Okay, I'm calling you from Miami, Florida.
Okay, terrific. You got a quick question for me?
Yes, I do. I have a grandson who's 7 months, and he had his first seizure when he was 4 months. Yeah, he's on medication, but he's had like 5 more.
Oh, boy.
First, thought it was a febrile seizure, but now he's got some more. So I wanted to see if you could see what's going on, or, you know, if you could see anything about him.
Yes, absolutely. What's his name, Myra?
His name is Bryce. Bryce.
Okay. And is he in Miami with you? Is he close by you?
He's in Miami. He's about 20 minutes from me.
Okay. All right. Got you. Going over to Bryce. Bryce, do I have your permission to scan you? He said yes. Okay. Got him on my radar. What I'm doing is I'm in his brain. Brain matter looks like thick cooked oatmeal to me. And scar tissue looks like chicken cartilage, the kind that you'd see in a chicken breast with the bone in. So what I'm doing is I'm scooping out the scar tissue that's in his brain. And then that's going to help the neural pathways fire. It's like if we're running an electrical current through a wire, Myra, the electrical current sometimes can get impeded. It gets stuck, and then like a spark will happen. That's what I see with people that have seizures. It's like from a neurological standpoint, that electricity is not able to run through the neural pathways and all of that. Imagine they look like a tube. So what I'm watching is I'm watching these little tiny corkscrews that are cleaning out his neural pathways of debris and things like that. In the meantime, I'm also watching some scar tissue get removed, and there are little dollops of stem cell energy that are being administered into his brain. And imagine there's a little vortex above each area. So when he has the seizures, it's causing some scar tissue to form in his brain is what I'm seeing. So getting that cleared out, and hopefully that will help with him. So I think he's going to be okay. He's darling from what I can see. So,
yes, he is.
Yeah, goodness, what a fright for all of you to have that situation.
You have no idea. It's something that you never know when it's going to happen.
I bet. All right. Well, hopefully that will help. Thanks for calling. Let us know how he's doing. Thanks, Myra. All righty, everybody. That's it for this week. What a delight to be with all of you. Thanks to everybody that called in. If I didn't get you on, please call back in next week. I'll do my best to get as many of you on as I can. In the meantime, I'm sending you lots of love from Sweet Home, Alabama. And remember, if you're interested in taking my class, I got 3 spots left for April. So you want to sign up. Bye, everybody.
Thanks for joining us. Be sure to follow Julie on Instagram and YouTube at Ask Julie Ryan and like her on Facebook at Ask Julie Ryan. To schedule an appointment or submit a question, please visit AskJulieRyan.com.
This show is for informational purposes only. It is not intended to be medical, psychological, financial, or legal advice. Please contact a licensed professional. The Ask Julie Ryan Show, Julie Ryan and all parties involved in producing, recording, and distributing it assume no responsibility for listeners' actions based on any information heard on this or any Ask Julie Ryan shows or podcasts.